Cholesterol. Part 2. Your liver produces the majority of cholesterol your body needs. Health problems caused by excessive consumption of cholesterol are somewhat minimized by your liver's secretion of good cholesterol. High levels of HDL indicate a healthy circulatory system. However, elevated LDL numbers suggest a cause for concern, as cholesterol can build within artery walls. Good cholesterol acts to help prevent atherosclerosis, a disease which hardens the arteries. Good cholesterol functions to remove excess cholesterol from the cells and blood. If the cell's repair rate, that is, its absorption rate, is slow for any reason, some of the cholesterol deposited in the blood will not be removed. If the thin smooth layer of the inner artery wall becomes damaged, these excess levels of cholesterol may get below and build up within the layers of the artery walls. The body defends itself against the intrusion of bad cholesterol into the arteries by releasing macrophages. The macrophage is a type of white blood cell. The macrophages feed on the bad cholesterol and can become engorged and large. Over time, this leads to a buildup of cholesterol plaque. As shown here, this is very serious, as it can cause the artery passage to narrow at the site of the accumulation. Over time, the cholesterol plaque becomes calcified, oxidized and hardened. This hardening of cholesterol plaque occurs, in part, as a result of free radicals in the blood. The result is a gradual stiffening of the artery wall and a dangerous restriction of blood flow. This combination increases the blood pressure at the site. The pressure build-up at this site can lead to a rupture of this stiff, inflexible artery wall. The resulting blood flow can produce a clot, which may further restrict or completely block all blood flow to any organs connected to that supply. This disease is called atherosclerosis. It is often implicated in heart attacks and strokes. Atherosclerosis is a leading cause of death in the United States. There are 3 approaches to the treatment of excess cholesterol in the blood. Treatment 1. This treatment involves reducing the amount of cholesterol in the body. This means that it includes eating foods that are low in cholesterol and using drugs that reduce the production of bad cholesterol by the liver. Patients on this form of treatment will need to avoid foods such as cheese, eggs and meat products. This is often difficult for many persons because it interferes with their food choices, and they must always be vigilant to ensure that they are not consuming products that are high in cholesterol. In addition, patients will often need to take drugs called statins. An example of one such drug is Lipitor. Lipitor limits the enzyme that synthesizes LDL, or bad cholesterol, in the liver. Lipitor targets the liver, as most of the cholesterol in the body is produced by this organ. However, these drugs can have serious side effects. Persons on statin drugs must do blood tests every 3 months to ensure that they do not develop side effects to these drugs. This is the conventional approach to prevent the buildup of excessive levels of bad cholesterol in the blood. Treatment 2. A process called chelation is often practiced by alternative medical practitioners to remove excess cholesterol from the blood. This process involves injecting into the blood a substance or chelating agent that will bind to the excess cholesterol and cause it to be excreted in the urine. This process must be repeated every 3 months, since it will prevent new accumulation of cholesterol in the blood. Often, these persons are also advised to go on a low cholesterol diet, similar to that advocated by the conventional approach. Treatment 3. The sabbatical diet increases the restoration activity of your body. This means that the process involves accelerating the use of LDL or bad cholesterol, thus quickly removing the excess cholesterol from the blood. This means that the patient is free to eat a sufficient, balanced, wholesome meal that will meet the body's energy and nutrition demands. Of course, the amount of food will vary per individual. This is determined by the height of the individual and his or her activity level. The sabbatical dietary program divides meal portioning into 2 branches: feed time and fast time. In this special program, you eat a sufficient, balanced, wholesome breakfast 6 mornings of the week, while the 7th morning of the weekly cycle is your fasting morning. You will be required to rest during this period. On the fasting morning, when the stress hormone, cortisol's, levels is high, the body destroys old tissue and converts it to glucose, glycogen, and nutrients to supply the body during the weekly fast. The breakdown of tissue that occurs on the fasting morning means that cells and other tissue are cycled out of operation or destroyed. This is an important and necessary function of the cortisol hormone. The breakdown of tissue on the fasting morning will accelerate the need for replacement with new tissues. This process results in an increased demand for cholesterol to make new membranes. Thus, the body makes far more efficient use of food on the 6 breakfast mornings. The result of this feeding and fasting pattern increases the removal of bad cholesterol, or LDL, from the blood. Thus, the body restores itself more efficiently on the sabbatical diet. And, in addition to the removal of the excess cholesterol in the blood, the body slows its aging process, and therefore assumes a younger, more energetic and vibrant appearance.